Healthcare providers and health insurance companies don't always agree on what should be covered, often leaving the patient stuck in the middle. Hi, everyone, and welcome to Hi-Fi Health News. I'm Erica Grotto. Today, I'm answering a listener question with Shawn Stack, a policy director at the Healthcare Financial Management Association.
It's a system silo, right? So the insurer and providers often don't communicate directly. They do so through interface exchanges. Their systems don't talk well to each other, and this causes delays and breakdowns in resolving those errors. And instead of sometimes defaulting to saying, tell your provider or your insurer to fix it, balancing out responsibility back onto the patient. And providers want to make sure they're reimbursed, and then, of course, payers want to avoid overpayment or paying on an incorrect claim. So this does come up, believe it or not, quite a bit. And typically, Erica, what a patient can do, and unfortunately there's no magic bullet, but I can provide you with some of those optional steps to try to reduce that frustration and move that along. Make sure you ask both sides for written documentation on what the issue is. From the insurer, what exactly is the claim denied or being held for? And from the provider, what correction or resubmission is required? Having that paperwork helps protect the patient from being assigned responsibility over something that they can't really control. And then use the provider's billing office. Insurers often won't talk to patients about claim coding, but they will talk to the provider's billing office. So ask to escalate with the provider's revenue cycle or patient accounts team. Ask that to be escalated on that issue. So they're pushed to resubmit or appeal that denial or that rejection. And then also you could file an appeal with the insurer as the patient. Even if the provider hasn't fixed the claim yet, you as the patient can file a member appeal. That forces the insurer to issue a formal response in writing, which can pressure both sides to act. And then you can also ask about patient advocacy. Many insurers have a member advocate or a case manager role. Their job is to help untangle payer-provider disputes. And if nothing else, and you hit a wall, you can file a complaint with your state insurance department regulator that takes balance billing and improper claim handling seriously. I've been really instrumental in facilitating a lot of those complaints with state insurance departments, and they typically get back when the patient's being balance billed inappropriately.
What if you are getting bills in the meantime? You know that you should be covering part of it. You want to pay your portion of it, but you don't really have a clear picture of what it is that you should be paying. Should you just not pay? I think you're going to tell me not to pay the whole thing, but what should you do in that case where you really want this off of the books for you, but not at your financial detriment, and making sure that everything happens properly on the insurance side?
Well, very unfortunately, it's not off the books until the claim's been resolved, right? So I think going back to asking for everything in writing and saying that the provider and the payer are following up to escalate the issue and resolve the issue is really important. If you are someone like me who understands their coinsurance or copays, especially if it's a copay or a deductible amount, you know what that set amount is. I would say, sure, go ahead and feel comfortable if it's a set amount and you know it's a set amount. You could go ahead and pay that, but definitely keep your documentation knowing that it's up to the payer and up to the provider to resolve the issues that they're having with their disputes internally.
All right. Well, thank you so much for helping us through these murky situations. They don't come up for everyone, but I think they do come up for a lot of folks. So, Shawn Stack, thank you so much for joining me today.
Thank you, Erica.
That's it for us today. I'm Erica Grotto for Hi-Fi Health News. Thanks for watching.